Guys, the prompt is the next thing. If you're not on, get on, okay?
Welcome back to the prompt, everybody. Today I'm here with a special guest, Wankumbu Kumano, because she's a psychologist, social worker, and a therapist. So how are you doing today?
I'm good. How are you doing?
I'm good. First off, I want to start by saying, how important is it relearning something, Because I feel like with what we are going to talk about, it's important to have that basis. So how important is relearning something?
I think, to be honest, I think relearning is a key part of life. For me personally, I had to relearn a lot of things, especially growing up back home. It's not everything, like the norms and the cultures are different here abroad.
Yeah.
In the US, so I had to relearn a lot of some of the things that I knew back home. So I think even just in terms of growth, personal growth, there's so many things that we have to relearn or unlearn as well. There's some things that maybe were not good for our personal being, mental health, or relationship interaction health, and we have to unlearn those behaviors or patterns that were not healthy for us. So I think it's very, very important for us.
I feel it's important for you to touch on what you studied and how it was like, from the beginning to now, for them to consider you as a more reliable source,
Right.
Yeah.
That's actually a good point. So I guess a little bit about myself, or briefly, I guess. I currently live in the United States. I moved here in 2011, and I came here as a student. And my area of study in the beginning was biology, which I was hoping to become a doctor. My parents were hoping that I became a doctor, but that did not happen because it seems I had different goals. So I switched my major of study, and then I began studying psychology. So I've always had an interest in just helping people or studying how the mind works or the body in general. So I now began studying psychology, and that was I did that for 2 years. I actually loved it, but then as time went on, I realized this is not it. I feel like I need to do something else. So I switched again to now study sociology. So I did sociology and graduated with that in 2015, the undergraduate degree. And then 2017, it took me like 2 years to now come back and go to grad school. So I now went to grad school for social work. And I graduated with that in 2019. And for my concentration with social work was basically, it was broad, but I kind of focused on the clinical side of it, which is now mental health. So for my internship in school, I was working with an agency that provided mental health and behavioral health for different clients. And after graduating, I was blessed enough to be rehired or hired by the same company that I interned for. And so I was working as a mental health professional at this company, working with teenagers, kids. Actually, like the youngest client I had, I think was 4. I think it was 3 or 4.
Oh, so
and
cute.
the clients who had different behavioral issues. Yeah, little baby, was so cute. And yeah, these are kids who had different behavior issues or mental health issues, and I'll provide just that care and almost like therapy help, if it makes sense, in those lines. So yeah, that's what I did, and that's, I guess, my expertise.
Okay, so let's talk about your podcast. Like, how did you come up with the name, and how has the journey been so far?
Yeah. So the funny thing is, I had no idea what to name the podcast. And I was literally sitting down, like right here, with a pen and a book. I was like, you know what? I need to come up with a name. So I went through so many ideas. I asked for help from friends, like, what name should I to give this podcast. So I just randomly started thinking of my nieces and nephews back home. And I was like, And one of my nieces, her name is Malaika. So I was like, you know what? Malaika sounds pretty cool. I think I'm going to use her name, Malaika's podcast. So I was like, something else. Then I just randomly thought of Malaika's Corner. So it literally just came to my head. I was just thinking of names, and I just remembered one of my niece's names. And that's how that name came to be. And to be honest, my niece is actually like one of those little people that actually inspires me. She's got this character in her that's very, very strong-willed, and also like she loves to help people. She's a people person, always there to help her siblings. So it kind of resonated with me. I was like, you know what? The name is cool, but the person that bears the name is super cool as well.
Yeah.
So she's very little. She's young, but she's super, super sweet, super loving. So yeah, it worked out. And I think so far the podcast, I've been loving it. I've received a lot of feedback from people that it's something they've been wanting to hear, especially the issue of mental health in our African community. It's just a topic that a lot of people actually have been thinking about, but maybe we're not comfortable to talk about. So it's actually, the feedback that I've received has been super, super awesome. So I'm grateful, and I'm glad with how it's taken off so far.
When somebody looks at Malaika's Corner, what exactly do you want them to expect, or what's the message surrounding it, like around mental health and other things?
Yeah. So the main focus for Malaika's Corner is bringing mental health awareness to our African society, communities, be it in the diaspora or back home, our African countries. And so that's the main focus, so mental health awareness. And also, it's also a platform or a station, a corner of discussion, discussing different topics. So it could be topics that are current affairs, could be topics that also affect people's mental health. We're talking about cases that affect our communities, African communities. Could be poverty, it could be general topics, or it could be like rape, or some of the issues that we've had back home, even like with the current-ish one, where, for example, where I think the minister back home, I guess, wanted all women to be dressing modest in order to reduce rape. So like maybe getting to hear from people like what their thoughts are on such topics. But the main focus for sure, Malaika's Corner, is to just bring mental health awareness and having mental health a very comfortable topic that our people can be having, and to break those barriers, the stigmas of mental health in our community today. So yeah.
Let's break it down a bit, like how do you define sociology, psychology, and the other one? Just to get reference as we are moving further.
Yeah, that's a good question again. I guess they're very similar. Sociology, psychology, social work. They are very similar, and they also kind of tie into each other. They kind of work together. I think the best way to describe psychology, I'm thinking of the mind. Anything to do with the mind. So your feelings, your psyche, your emotions, anything to do with the inside. So anytime you think of psychology, think of how the mind works, all those connections inside your mind, your body, your feelings. Then when you think of sociology, you're now thinking of the outside, so which is now like human interaction. It's like the study of human interaction, society, how the society works, and also just maybe even just like economy, the government, so all of that affects us on the outside. And then when you think of social work, now this is the actual work. You're actually now going to work for and with people, helping people with different needs. And I think all these sociology and psychology tie into social work. So with social work, you're actually now, it's very broad. You can do so much with it. You can actually go out and help people in their homes if they're having issues, or any issues with finances. You're helping people have a plan on how to live independently by themselves, or you can go on the clinical side and work now as a mental health professional, a therapist, or counselor, whichever way people call that, counselor, therapist, or you can work in hospitals as a social worker in a hospital. There's so many routes you can work with it, but it's specifically for working people, with helping other people. So yeah, that's a little brief description of each one, but even though they are very similar. So yeah.
You know that when I listen to that, you know, it's a sense of community and family and feeling safe around somebody, you know. So what impact has your childhood and your environment growing up motivated you to do this, like of all things, you know?
I think for me, it's a lot to do with my childhood or my upbringing that motivated me or gave me that drive to do what I do today. Starting from seeing how my parents were and how they were very, my parents were willing to always help people in the community or friends, family. They were always very much willing to help, even if they had nothing that they don't. They were Christians, so they always followed God's teaching of being a good servant, which is helping anyone that's in need. So I grew up with a lot of extended family or friends that lived with us, and it was beautiful seeing that. And I think just seeing how my parents lived their lives, that gave me like a push or a drive to do what I do today, to have that passion to be where I am today. So that has, my childhood and my upbringing has had a major impact on who I am today and what I do. So I really do owe it to my parents for sure. So yeah, a bit about that.
How has social work created new opportunities for you?
For me personally,
yes.
I think for me, like example being this podcast itself, just having that the knowledge that I never had before, it has helped me have a platform where I could be able to communicate well, and basically having effective communication and conversations with people. It's taught me how to work around different personality types. Because before I did what I did, before I went to school for social work or any of sociology, I was kind of like just everyone else. You know, if there's someone who has a problem, you just like, they have a problem, and you know, that's it. But now it's like I have an understanding of different situations, of different problems that people go through. So I have that it builds empathy, and I believe that's something that it has helped me with, like that empathy, being more understanding of people and being more compassionate of situations, and not just looking at the situation as it is, but being able to analyze and dig deeper into something. Like, so I think, to make it short, it's really helped me have built and learn what I knew before of just seeing something as it is, and learn to actually grasp a situation on a deeper level and understand people more. So yeah.
So, you know, I'm a curious mind, you know, and I'm sure others are. So you said, you know, you work at a non-profit organization, you know. I want you to tell us your experience there, and do you guys get paid, or is it like, you know, the company that doesn't make profit or something? Because, you know, I'm curious.
A lot of people actually ask that. That's another good question. I used to think that too, like, so if you work for a non-profit, do you get paid? Where does the money come from? No, you actually do get paid. So there's ways around it where sometimes, so people do donate to non-profits. There's a lot of donation. A lot of other organizations that help funding. And then another big part with non-profits, I know that's here in the US, I don't know about back home. I need to do more research about that. but the government also helps with funding, especially because we are working with people and working for people. So most of the people, the clients that we have, receive government funding, or government assistance, be it from insurance or maybe just other types of assistance that are available, assistances that are available. So with our nonprofit, we receive different grants and funding from the government or people's donations as well. These are main places that help with funding, and then just other organizations as well that help as well. But yeah, the government does help nonprofits with funding here, or some of them. Especially when it comes to like social work and mental health, they definitely help because we're helping people. So yeah, we do get paid, and it's not free. And then when you talk about like, especially like with therapy, there are some people that come in privately and pay for it. So you also get money that way from clients. So yeah.
Alright. Now you know. So my next question to you is, what is mental health to you? You know, because I have a definition that, you know, it's something to do with how you handle your emotion and other things within, and also how you balance it with external things. So, what is yours?
What is mental health to me? Basically what you just said. I believe for me, we all have it. We all have mental health, mental well-being. I think it's what makes your inner self. So your emotions, your feelings, your having. It could also be having positive relationships. Everything that makes you well. That makes your emotions well. It makes your feelings, your inner being well. So we always talk about, like, for example, medical health. It's like medical health as we understand it, or physical health is like what has to do with our bodies, being not sick, right? Yeah. So when you think of mental health, basically the same thing, but with the inner state of you. So your mind, your thoughts, your emotions, your feelings, those things that you feel on the inside, if you are well, if you're not sick, if you're not distressed, all of that sum together, that's your mental health, your mental well-being. So yeah, that to me, I think that's my unprofessional definition.
No, that's good. You know, when I was listening to your podcast, I heard something very interesting and it couldn't skip my mind about how mental health is not really focused on, and how, like, maybe when you're facing a war, right? You know, you have negative things because you don't know, but when you turn, you see that it's not as bad as you know it is. So I'd like you to explain the negative side of where people are not knowledgeable and what it actually is now, you know?
That's actually a good one. I actually remember my friend Change mentioned that, and I love that statement. I was like, that analogy, I've never thought about that. And I was like, I am definitely going to take that for my clients next time. But that idea of being faced in a wall, and you're stuck in that wall, and all you can see is like your negativity. It gives you, I think that example, it just gives you an example of whenever you're faced with negative thoughts, or when your mental wealth or mental well-being is not okay. It's like you're stuck in a wall. Basically, you're just facing your negative thoughts, anything in your life that is causing you unhappiness, or causing you to not sleep well at night, to not have good mental state. That whatever those things are, they're in a wall, and you're just facing them, and you can't turn away. But it basically, in therapy, we kind of help clients to kind of turn away from that wall, to be able to see what's behind them. So it's a work in progress. And trying to answer the question, I think that example itself basically answers it, and that's basically what mental health, mental and what's unhealthy mental health or unhealthy when you're in an unhealthy state of life, you're faced in a world with all your negative experiences, negative thoughts, anything negative that is not helping you at all.
Yeah.
So, and imagine everything positive is behind you, but you're making yourself face the wall instead of turning around. So when you come to see maybe us in therapy now, we can work with you to learn how to let go or turn away from those negative things. And I think, to be honest, we all go through that. We've all been at a point in our lives where we are stuck in a wall and we feel like we can't leave, we can't turn away from it. But we actually can. And it takes work. It takes a lot of work to be able to face away from those negative things in your life. So yeah, I hope I answered that question.
Yeah.
With therapy, one thing everyone should know is us as mental health professionals, it's very strict. We have to keep everything confidential.